I once heard that when the blood deposits of hepatitis is being left outside the body, maybe it spills on the ground, that the virus itself can last for days after. But it's not so with HIV. So that brought some curiosities, because ideally when you hear about HIV, it's often seen as the most feared infection, dreaded in the world. But do you know that there is another which is a silent threat and which claims life too? So I'll be doing this comparison as we go on in this video. Stick with me to the end so that I can show you some healthy tips that can help prevent both. Thus, we are comparing which is deadliest, HIV or hepatitis B. Now, what are HIV and hepatitis B? What's these words? What are they about? Now, HIV is a virus that attacks the system, the immune system, weakening the body defenses and potentially leading to AIDS. And then what's hepatitis B? It's a virus that attacks the liver, leading to inflammation, cirrhosis, and liver cancer. So you see that HIV attacks the immune system that's in the body. You know, immune system is not just one organ, it's everywhere in the body, flowing through the bloodstream. Why the liver, it's a particular organ that hepatitis attacks. But you know, this liver, it's a very important organ because of the great functions it takes. So now look at how are they transmitted. We want to know, how does this one transmit? How does that one transmit? So how are they transmitted? We see that HIV spreads through blood, sexual contact, and mother-to-child transmission, but is less resilient outside the body. Remember what I told you at the beginning, the virus dies in few hours, HIV virus, outside the body. But let's go to hepatitis. Then we see that it is transmitted and more infectious. It spreads through bodily fluids, like, you know, bodily fluids when you share needles, unprotected sex, and from mother to child. Now take note of bodily fluids. Here HIV is primarily through blood contact, right? Now hepatitis is bodily fluid, so it's not just only blood contact, but bodily fluid too can transmit hepatitis B. Then next we see that it is necessary, you know, all these viruses are being viewed through the microscope. You go to lab, you know, you request for the test being done. I think currently now, due to the heads of all these organizations like WHO, all these tests are being free. Like HIV, I know is free of charge in the hospital. Then hepatitis, maybe you pay some funds for it. It's good to know your status at the present so that you can know where you move on from. Now, what are the symptoms of this disease? Now, HIV leads to weight loss, recurrent infection, fever, and night sweats. These are signs that you will see when you have this unusual weight loss and you don't know what's causing it. Then you need to check. Then hepatitis will lead to fatigue, nausea, abdominal pain, jaundice. Especially jaundice is a key one, because when the liver is not functioning, it can break down bile and then it leads to jaundice and joint pain. Then we have, what are the long-term health impacts of these diseases? Now in the HIV, it weakens the immune system over time. It leads to AIDS and vulnerability to other infections. Any infection that comes, you just catch it. That's what happens in HIV. Then in hepatitis, you see that it leads to the risk of chronic liver disease, cirrhosis, that's scarring of the liver, damaging the liver, and then liver cancer if untreated. Now, what's the treatments or the cure concerning this? Number one, we see for HIV, we see that they are treatable with the antiretroviral therapy. That's what the ART means, antiretroviral therapy, but requires long-term management, no cure or no vaccine. So for HIV, this antiretroviral therapy is given free of charge. this is being sponsored still by the World Health Organization. So it's good to know your status and start being on your medication if you have it. And if you don't have it, you have to prevent yourself, mind personally, because there's no specific vaccine to prevent yourself. So you be cautious of not sharing sharps. Then we see the hepatitis, that it is treatable with antivirals. Yes, but there is a vaccine to prevent it. So you see, it's different from the HIV. HIV, as of today, no vaccine. But for hepatitis B, there is a vaccine that can protect you from it. Once you check and you don't have it, you take this vaccine and you are protected. But if you have it, you can treat it with antivirals. Then you have mortality and severity risks. Mortality has to do with how many deaths, the death rates, and then how severe it is. Then for HIV, we see that it is potentially fatal if untreated, but with the antiretroviral therapy, it can prevent progression to AIDS. The antiretroviral therapy tries to slow down your CDC count, and so that it will not progress to AIDS. Then we have the hepatitis B. It has higher mortality if it progresses to liver cancer, especially in chronic cases. It leads to death. Once your liver is having any issue, it's very difficult to manage. Prevention is the key, so we should know about that. First step for HIV, safe sex. You can use condoms to prevent transmission. And then needle safety, you have to be careful with sharp objects, and then check yourself, regular testing. December 1st actually is known to be HIV Day, and in that day, at least it's a reminder. People do, there's this free campaign test done to help people know their status and know what's up, and then also help the health team to know how much drugs to make available where necessary. The hepatitis is through vaccination. The vaccination too, in some cases, is free. For some sets, I think under 5, but for adults, it's just a token. It's not much. It's very little amount. You pay for it. Then you have safe practices. Avoid sharing needle and just be safe. So it is necessary you go to the hospital to get necessary health assistance. It will go a long way. And then check yourself. Just know where you are, where you stand health-wise. If you need to take drugs, take your drugs. It will go a long way. Don't feel as end of the world. Take your drugs. So now, which is more deadly from our conversation? Is it HIV or hepatitis B? I want you to write that in the comment box. Let's talk. What do you think? Which is more deadly?